This is an age of disruption, of profound revolutionary change.
What we're really asking ministers is to empower the ambassadors.
The only thing that you really push forth is the truth.
You don't see many women represented when it comes to the decisions as to how to handle the pandemic.
Good afternoon, everybody. Welcome back from lunch to the second part of day one of Politico's Healthcare Summit. I'm Joanna Roberts, Politico's health editor. And this afternoon, we're going to move on to some of the pressing challenges Europe is facing and some of the solutions on the table. So first up, we've got a stock take of HERA, Europe's Health Emergency Response and Preparedness Authority, which was originally conceived as Europe's answer to the US's Biomedical Advanced Research and Development Authority, or BARDA. So how is it faring? Ashley will guide us through a conversation on that next. Following that, we have an extremely timely panel, given the Commission's paper today, on preventing drug shortages, so we can avoid a repeat of the medicine stockouts we saw across Europe last year. After that, I'll be leading a panel on whether Europe has let its health workforce down and how it can solve some of the problems that are leading to massive understaffing across the continent's health systems. And we'll round out the day with a session on plasma donations, whether to compensate or not. Before we kick off, I'd like to thank our partners for making this summit possible. Our leading partners, AstraZeneca, FPA, Emergent, Pfizer, and PPTA. Our presenting partners, Intuitive, Janssen, Novavax, STADA. And our visibility partner, the European Federation of Nurses. And a reminder, you can ask questions through the swap card platform. If you're in the room, there's QR codes to scan. Otherwise, check out the instructions on the event website. If you're already on the platform, please continue to chat and do ask questions in the questions box to the right of the desktop screen and below the live stream on the mobile. Please do talk about us on X or the social media of your choice, and our Twitter hashtag, just to remind you, is Politico Healthcare. And now, without further ado, I will leave you in the very capable hands of our health reporter, Ashley, who will lead the first panel of our afternoon on whatever happened to Europe's BARDA. Thank you.
It's difficult. Easy.
Big children, big words.
Whatever. Okay. Good afternoon and welcome to the Health Summit. If you're tuning in now, I'm Ashley Furlong, a healthcare reporter at Politico. We're going to be talking about the Health Emergency Preparedness and Response Authority, HERA, 2 years since its inception. I think actually a little bit more, possibly. HERA is meant to be the EU's answer to BARDA, but it's faced difficulties being created in the middle of a pandemic. Unlike BARDA, which represents one country, HERA needs to represent 27 and ensure that they're all ready for the next health crisis. And I think that's sort of the crux of it. It's the bloc's plan to ensure that the EU can speedily respond to crises, whether that's drug shortages or the threat of new pandemics. And we're going to talk about whether it's actually doing that and what it needs to set it up for the future. As we've heard multiple times today, there's many crises going on and there's going to be many health crises in the future. And HERA is possibly going to be have a critical role to play there. Before we get going, just a few housekeeping remarks. You can ask questions on the swap card platform. If you're in the room, you can scan the QR code on the screens, or you can check instructions on the event website. I should have an iPad for those questions, so someone could get me an iPad, that would be good. Please talk to us on X or the social media platform of your choice. Our hashtag is Politico Healthcare. And we couldn't have two better placed speakers to have this discussion today. We have Kathleen van Bremt, an S&D MEP, who is chair of the Special Committee on COVID-19 and focused a lot on HERA and HERA's role. We have Laurent Mouchel, deputy head of HERA, acting deputy head of HERA. Deputy head.
Acting head.
Acting head. I'm going to kick off with Laurent. It's been 2 years since HERA's inception, and I wanted to know what you thought the big successes had been of HERA.
Well, thank you for the question. I don't know, there are still some seats available in the front row. So people are afraid or no? Just join us and don't stand up in the back. Anyway, on your question about HERA's success, I think HERA is, as you said, is 2 years old, so it's quite young organization, and that you have to factor in. But over the last 2 years, we have managed to do quite a lot, I would say, and it's quite impressive. I can say it from distance because I only started this year in HERA, so I can judge it with some kind of impartiality. First of all, we have established ourselves among member states, and it was agreed that we set up this organization during the COVID time. It was not to set up a BARDA type of organization. It was to set up an organization that can reply to the next pandemic. And of course, we took inspiration from BARDA, but our mandate goes also a bit beyond, and I can explain that later. In terms of success, we have, for instance, started to stockpile medical countermeasures, which are necessary for health crisis. And we have put already in motion 1.2 billion euros of medical countermeasures, so kind of significant. We have launched a facility called EU Fab, where we have reserve manufacturing capacity in Europe. So if a pandemic hits us, we have guaranteed production in Europe up to 325 million doses to cover EU citizens. And the companies have to deliver that within a year, half of it within 6 months. So we have put some obligation on the companies to deliver a vaccine with reserved manufacturing capacity. But we have also developed a network of laboratories called Durable, with the best labs in Europe to do better surveillance, to make sure that we have the right signals and to check whether we have the right medical countermeasures based on the threat. So for instance, Durable Network have been used now for avian flu, because we see a rise of avian flu cases among mammals and with the risk of transmission to humans. And this lab is testing whether the vaccines that are available will answer the threat. So we have created that network. We have also internationally developed a lot of partnership with international partners, be it BARDA, and we have a working arrangement with the United States, ASPR and BARDA. We have one that I'm going to sign on Friday with Japan. We have one with Korea, but we have also established partnership with WHO, with the Gates Foundation, and so on and so forth. So we are really now becoming a key actor on the global health scene, and I think it's something quite successful. We have just launched also, beginning of October, a new facility called HERA Invest with the European Investment Bank, where we will support small and medium-sized companies to go to next phase of development to get the new medical countermeasures. As you know, the biggest challenge is to get products out of the pipeline. A lot of people are calling that the valley of death, and it's very challenging for the companies to move from one phase to the other phase, and we will support that with adequate financing. So overall, we have intervened in many spheres, from research to production and stockpiling. So we are really starting to act on all the aspects of the medical countermeasures area and growing steadily.
We're going to get into Here Invest, and I'm sure people in the audience might want to hear a bit more about that a bit later. But Kathleen, I'm wondering, as it currently stands, do you think HERA is setting the bloc up to be adequately prepared for the next health crises?
Good question. Let us go back to the beginning of the pandemic, and that's also why we had in the European Parliament the COVID committee. I think it's important in policy and politics, we often just rush from the one crisis to the other without taking the lessons learned. And I think especially with the pandemic that was so specific, and we all know, well, I don't know, I don't have a clue, but if I listen to experts, a next pandemic will come. We don't know what it will be about in terms of what medical challenge it will be, but there will be a next pandemic. In the start of the pandemic, I don't know whether you remember the first lockdown, okay, excellent weather and everything, but there we were. And immediately in Europe, borders closed, also for goods, and the essential products we needed, I'm not talking about vaccines, that's for the year after, but were not available. And I remember that, for instance, what we needed was inhalators, that to produce inhalators, we do not produce so many inhalators in Europe anymore, but to produce them in Germany, they needed a supply from Poland, and they closed the border between Poland and Germany. So there was almost nothing. And I have to say, if you look to other parts of the world, if you look to Asia, of course, they have more experience with epidemics and pandemics and so on. But also, when you look to the United States, and your question on BARDA will come up, at least they had emergency vehicles in place, and we haven't. Of course, Europe is Europe. We don't have the competences yet. Of course, during the pandemic, it often happens in crisis in Europe. In Europe, we take these competences because the member states are looking for coordination and they ask for response, and they see on big issues, whether it's a pandemic or a war or other geopolitical issues or supply chain problems or medical shortages, more and more they see they cannot cope with it. They cannot cope with it themselves. Okay, that was the situation, and after a few weeks, some will say months of utter, despair, and there was the Commission acting, started acting, and I think we did excellent things during that pandemic in Europe. Not everybody, it remains all very technical, but we made sure there were budgets to create HERA, we made sure that there were vaccines and the budgets to buy these vaccines. So a lot of things happened, and I think what we see now, where do we stand now with the European Health Union? Well, I would say we're more or less halfway. And HERA is a very good example. We have HERA, they do excellent work, but are they fit for purpose? Not yet, I would say. Many other things need to happen. Of course, there's always the budget. The budget of HERA is not very big. It's too much dependent on different budget lines. And of course, when a next crisis comes up, I'm quite sure that the Commission will act swiftly and the Parliament will help them doing that to make sure there are extra budgets. But still, if you combine the budgetary issues with the lack of autonomy, that might be even more difficult and more urgent. A HERA should be an autonomous instrument, an autonomous, looking for the word, agency operating in Europe, and not be part of the DG Health. Because for these issues, you need to be flexible, be autonomous, and give answers immediately. So we're not yet there, and I think we're at the end of the term. And again, I'm very positive on the things that we've done, but looking forward to be prepared for the next crisis on health issues. we're at the end of the term. It's now high time that the Commission looks to our conclusions in the COVID committee on these issues and take them on board and prepare in the next Commission and the next Health Commissioner to improve HERA in their budget autonomous, but also the way they can act. Can I give the example of BARDA? Because I also went to the States to have discussions with people in the White House and in BARDA on these issues. And of course, we are not the United States. We have to create our own model. But one of the issues that really struck me, and that is extremely important, you do remember what happened on the vaccines. In the beginning, we were so happy that we created these vaccines. We first had AstraZeneca, and then we had the mRNA technology. But all of a sudden we realized, oh, we have now vaccines, we have the formula, but we don't have the capability to produce them. And I have to say, the Commission did excellent work, especially Commissioner Breton, who actually went from company to company to be able to get that production in place. But we don't have the legal tools, and HERA doesn't have the legal tools to enforce these issues. And BARDA does. They can go to Coca-Cola, it's a stupid example, but they can go to Coca-Cola and say, well, now you're producing Coca-Cola, that's nice, but the next couple of months you will be producing some sort of formula in your bottles, and you need to do this and this and this, because that's what we need to combat this virus. So we're not yet there. So halfway, let's say.
Would you like to respond to that? Would you like HERA to be have more authority? And I think there's two sort of aspects there. I suppose when we're comparing to BARDA, you're actually talking about the sort of the legal abilities as well of HERA. But I think separately as well, you know, should it be a standalone agency separate from DG Santé?
Well, we are separate from DG Santé. We have Director General of the Commission, independent from DG Santé, first thing. Second, we have a special governance. We are not a normal Director General. We have the title of authority. We have an ERA board composed of all the senior health experts from the member states. And we report to them, they discuss the work program. So we have a kind of hybrid between a DG and a normal DG and a regulatory agency. I fully agree on what Kathleen was saying about autonomous budget. I think it is important for the time being. It's one of our challenges because we are using the Horizon Europe, EU4S, and Rescue money. That can be challenging. And in the next MFF, to be a bit technical, in the next financial perspective, we need to have our dedicated and autonomous budget. That is quite important. And so that the budget also is secured and is not changed according to new political priorities. It's true, and I'm not talking about the Commission now, I'm talking in general. There is a post-syndrome amnesia at the political level. You know, you move from one crisis to another. Everybody has forgotten about COVID. Now it's about Ukraine. Now it's about Israel and Hamas. There will be another crisis. But we need to have sustainable funding for the next years to prepare for the next crisis, because that needs to be prepared well on time. We have seen with the COVID that we were not sufficiently prepared. And on top of it, we benefited from a number of years on coronavirus research. So we were, in fact, quite lucky to have a vaccine quite easily made. But it could not be. It's not going to happen again this way. So we need to be better prepared. So having the right budget is important. In terms of manufacturing, well, I'm not dreaming of ordering Coca-Cola to produce a vaccine. Maybe I think it's not going to happen anytime soon. But that's why we have created this EU FAB facility, which in fact reserve manufacturing capacity. We have manufacturing capacity ready for pandemic, and we audit that So we check the companies that they have reserve capacity, and when the crisis hit us, we know that we can produce very quickly the vaccine. So we are taking the lessons from COVID. We have also developed new tools with joint procurement, advanced reservation capacity. So we have developed a number of tools to prepare for the future. Now, in terms of becoming completely autonomous from the Commission and becoming an agency, we are conducting ERA review. And by the way, there is a public consultation ongoing, and I invite you to reply to that public consultation with your views. And we will see, and we will propose, we'll issue a communication next year based on the review in Q2 of next year, where we'll take position as a Commission whether ERA should stay a service of the Commission or should become an agency. There are pros and cons. It's not black and white. But what I can say is that we decided to create ERA as a service of the Commission during the crisis because we had no choice. An agency, you need first an impact assessment to prepare regulation. It takes a year. Then you need co-decision. It takes 18 months at best. And we have seen there is on the table of the Parliament and Council a proposal for an agency, a regulatory agency on child sexual abuse is still stuck. So it takes a lot of time. And then you need to agree on the seat where it's going to be located. It's by unanimity in the Council. It takes a lot of time to agree on the seat. Once you have that, you need to recruit. You need, and that will take another month. So we were directly operational during the crisis. ERA was immediately operational. Creating an agency will take 4 to 5 years minimum. And then when the crisis hit us, if the agency is located in a remote area, it's difficult to have access to the political level. And we need direct access at the highest level during crisis to mobilize the money. You need to talk to the health minister. You need to talk to the president of the Commission. So being in Brussels, that allows us to do that. That's the pros. The cons, I can also drag on.
I want to talk briefly about joint procurement, as that's one of the major things and major sort of undertakings of HERA. And there have been some deals announced, but it obviously is difficult. You trying to agree with multiple countries, negotiate with, so it can be complicated. Kathleen, do you think that the joint procurement has proved itself under HERA and as an effective mechanism, and how would you like to see it in these discussions improved?
Well, let me first say that I'm absolutely in favor of joint procurement, not just on the vaccines in a pandemic, but also on not anything in medical products, but in Europe there are a lot of medical products, medicines that are, well, you need them in the whole of Europe, and you need them widely, and there is widely a shortage. And doing joint procurement will help us at multiple levels. It will help us on the price, it will help us on the value chain, it will help us to be powerful when it comes to changing the value chain, and so that should be the goal. Again, the next commissioner, and I hope the next commissioner of health takes these issues into account, they need to work on that, because it means before we have some sort of treaty change, we can have discussions on treaty change, and I think we need to do that, but that takes more time than an agency. So before we have that, it's about convincing the member states to go in that direction. But we really need to do that. It benefits at every level, and it most of all benefits the patients in Europe. So in that sense, what happened on the vaccines is a very good example and is a very powerful example, although mistakes have been made, and we need to take them into account as well. And that's what we did in the COVID committee. So again, by doing the public procurement together on the vaccines in Europe was in the benefit of all the people in Europe. And I always give that as an example. Can you imagine that in the midst of that pandemic, where people were sitting at home, our economy was nowhere, or almost nowhere. People were dying because they were in healthcare working or in primary jobs, whatever. And you would have a vaccine, and you would have production, and Germans would be vaccinated months before Lithuanians, or Danish before Spanish, just random examples. That would have created maybe huger damage than the Brexit did. And the Brexit did do a lot of damage. So you always have to look at the politics as well. And so the right things have happened over there. Mistakes have been made, and I want to point them out because public procurement is, of course, always very vulnerable when it comes to corruption. And I'm not saying corruption has happened, absolutely not. I'm quite even sure corruption didn't happen. But what did happen on the third contract with Pfizer, you remember the text messages, or the so-called text messages between Bourla and Ursula von der Leyen. I'm quite convinced that things have happened with the best of intentions, but when it comes to public procurement, there needs to be clear guidance, rules in place, and they need to be abide by that. And I rest assured that in HERA they work really very good on these issues. But it is crucial, because it is so vulnerable, public procurement. And since we have to fight for European public procurement in this field, it is essential that we do it without mistakes.
And what's the biggest thing sort of making joint procurement difficult at the moment? What sort of slows it down? What would you like to see change? Is it the negotiations with pharmaceutical companies? Is it the bureaucracy within the Commission? What would you like to see? What obstacles would you like to see lifted?
Well, first of all, I fully agree with what Kathleen has said. I mean, this was a major success to make sure that every citizen in Europe could benefit from a vaccine at the same time and at the same price. So that's very important. And we are now expanding our joint procurement activities to a number of areas. And one question, and we have just adopted a communication today on access to critical medicine, is to expand that beyond the medical countermeasures linked to serious cross-border health threats. This is quite important that we use that tool, that we develop that tool to make sure that everybody benefits. There are some rare diseases where countries in some member states do not have access to the medicine. And by pulling our forces together, we have a better purchasing power, and we can negotiate under better terms, and that's what we are doing at the moment. During not this summer, but the summer before, we had the mpox, the monkeypox crisis, and it was also a big success from HERA because within 2 weeks we have managed to negotiate a contract with a sole company producing vaccine for mpox, and we got them delivered to all the member states, and we covered the need. So we managed to avoid a major crisis in Europe. So for the future, I think we need to have this tool as flexible as possible. We make it voluntary, so we don't have to have all the 27 member states on board. You only need 4 member states, and we can negotiate on their behalf if there's a need to access to certain medicines. What I would see as a challenge is when a member state wants to join that contract later on. For the time being, it's not allowed. You have to participate from the start. So let's say we are now procuring avian flu vaccine because of the risk, but we have only a dozen of member states who wants to participate, and suddenly a member state wake up and say, oh, now the crisis hit us, and they want to join. It's too late. For the time being, the rules do not allow to do that. So that's something that we have to look at. There are some reasons for not allowing that, because you don't want to have horse riders, benefiting from it. But shouldn't we have more flexibility for that?
Will that be part of the review process to see if those need to be changed? That needs to be changed?
Not of the ERA review, but it's part of the joint procurement review, if you want.
Yeah. we mentioned shortages, and obviously we have this communication today, and we have a lot of concern coming into this winter. Kathleen, do you think that the EU is taking an aggressive enough approach on this? And I suppose today we got the new communication that people are still trying to digest, and maybe that partly answers the question. But I'm wondering what you think of the EU's approach.
Well, I haven't been given the chance yet to look into it in detail. We'll do that ASAP. But we had a debate in the Parliament a while ago on medicine shortages. And I have to say, I think it's also not only, but also thanks to the upcoming Belgian presidency that has pushed a lot in this direction. And I'm very grateful that they did. I think the Commission could have been swifter and better in replying to that, because you have these, that's the way it goes. You have a crisis, a severe crisis like the pandemic, you learn from it, and then you take that on board in your regular policies. As I said on joint procurement, the same is on shortages. And the things are related. It's been mentioned, not just the pandemic, but what's happening in the world, the war in Ukraine, what's happening now in the Middle East. The change of geopolitics, the fact that we have these shortages is related to two very important issues. The first is there's a shortage of all sorts of materials and all sorts of ingredients. I'm not a specialist, I'm neither a pharmacist or a chemist, but there's huge shortages. We have them for our green transition as well. And the second is, and that is also related to the green transition and to what happened at the geopolitical level, that is, all of a sudden we realize, and we've been so naive in not predicting that because it was right in front of us. All of a sudden we realize that we are so dependent on the rest of the world and mainly China. There are medicines that we do not produce anymore. We have one production of antibiotics still in Europe. We have shortages of painkillers, of all sorts of, and we are reliant on the rest of the world, mainly China. And with China, it's not a country like any other. So diversification, getting production back to Europe, and I'm not saying that we have to produce everything on our own, absolutely not. We keep an open economy. It would be completely crazy to do it only ourselves, but we do have to make sure that also on critical medicines that we have at least, resilient value change, and that we also push some production back to our. So let's have a look at that communication, but I think more needs to be done, because otherwise, it's essential. What do we do without medicines and other medical equipment? So,
Laurent, you mentioned the Hero Invest program earlier today, and I'm wondering what kind of projects do you think that you're expecting to fund? Who should be pitching to you? If you're in the room and you're a company doing exactly this kind of work, tips, advice for them. How should they be approaching this?
Well, any companies which is developing new medical countermeasures could apply it. They're based in Europe. I was yesterday actually in Luxembourg at the European Investment Bank, where we were looking at the companies who have already applied. So we have already a good number of companies who are applying with very interesting projects. There's a lot of innovation in the field. The problem is that it's difficult to translate the good research into a product. And that's a challenge. So we are here to support that. But of course, with the money we have put now this year, we'll be able to finance up to 800 million euros, I think, maximum of loans. And that goes very fast. So I think around 7-8 companies will be selected. But please react quickly. And take contact with us to apply. We are in the process of selecting the companies with the European Investment Bank.
Very quick question. We are out of time for both of you. 5 years from now, what would you like to see most from Hero? Bigger mandate, more cash to be an agency. Sort of one thing that you'd like Hero to have five years from now.
Oh, OMG, always these last questions. They were so tricky. Well, as I said in the beginning, I agree what Laurent said on agencies, that it takes a lot of time. And so within the pandemic, we needed to act quickly. And the Commission did, again, with the support of the Parliament. And so we did the best we could. But I do think we have to now make sure that, as I said, halfway, we do need them to be autonomous and act on their own and not be dependent on a commission at that time when the pandemic is starting. We see that I'm a politician. I like and I love politics, and I think politicians should be in the lead of politics. But when you're in the middle of a crisis, you need crisis management. And politicians are not very good in crisis management. So you need to have an independent, autonomous agency with a clear budget that can swiftly go up when needed.
I'm assuming it might be budget for you. You might want more cash in there.
Well, definitely, but I will not take it from that angle about the institutions where ERA should be and so on. I would just look at what we are meant for, the end products. So I think we have a list of 10 pathogens with a high potential to turn into pandemics. We have the antimicrobial resistance, which is in fact a silent pandemic. In 5 years' time, there will be more deaths from antibiotic resistance than from cancer. We have the cyber threat on the increase, and I look at the geopolitical situation and the terrorist threat. And for each of these threats, I want in 5 years' time that we have a medical answer, that we have the right products to answer to the threat. And that's what we need to do. And that's what we are working on with our partners. We cannot do that alone. We have to work jointly. It's a massive amount of money which is required, but that is our target.
I think everyone would agree with that ambition. HERA is just still a baby, and I think it's actually just a toddler now, 2 years old. It's got many more years to mature and to develop into what the ambitions people have for HERA. Thank you both so much for this discussion. And everyone, please remain seated. The next session is going to begin shortly on preventing drug shortages, moderated by Carlo Martuscelli. Thank you.
Thank you very much.